So thank you so much for the kind introduction. And I want to thank Seikka Salma Foundation for inviting me here. This is a great honor for me to be here today really and discuss with you this important question. Is there something we can do to prevent memory problems and Alzheimer's disease? What I will do today is try to give a short overview what our research has shown, especially about lifestyle factors and the brain health. I'm also working as a doctor at the memory clinic, and that's why I also want to give a bit the patient perspective, why it's so important to diagnose and treat Alzheimer's disease. But before we move on, I would like to ask you, how many of you know someone with Alzheimer's disease and dementia? Maybe some family member or friend? You can just raise your hand. Nearly all. Yeah. Is there someone who is working with patients who have Alzheimer's disease at the medical field, or maybe studying to be at the healthcare sector? Yeah, a few hands. The final question, if you dare to raise your hand, have you been worried for your own memory? I need to raise my hand. And it is the thing, in the modern, very, I would say, hectic, demanding society with a lot of information and demands, it's very common to feel that our memory is not enough. And importantly, the ideas I will give you today can be used not only to prevent Alzheimer's disease, but also if we want to try to optimize the memory functions in all ages. The first part of my talk, I want to give some basic facts about dementia and Alzheimer's disease. First, this confusing fact, what is dementia, what is Alzheimer's disease? I know it's not always easy and it's a bit confusing. So dementia, I would call it syndrome. It's an umbrella term. It's not a single disease. It describes different symptoms of group of conditions that impair memory, thinking and behavior. And the most common form of dementia is absolutely Alzheimer's disease. It counts for approximately 60 to 80% of all dementias. But as you can see, there are also other forms of dementias. They will not be the focus of my talk today, but if you have interest, I'm of course happy to answer questions related to these dementias after my talk. Alzheimer's disease is a brain disorder. We know now that in Alzheimer's disease brain, there is a protein called beta amyloid that accumulates and develops plaques so that nerve cells can't communicate with each other. And finally, nerve cells die. And because of the new neuroimaging techniques, we can nowadays visualize many of these Alzheimer's changes. Alzheimer's disease is a disease in the brain, but it affects the whole human being, movements, behavior, everything. And it also affects the relations with the family members, it affects the whole family and friends, and even the whole society, because we know that especially at the advanced stage of dementia, these patients need a lot of care. What are then the typical symptoms of Alzheimer's disease? The disease starts very often with short-term memory problems. It's difficult to remember what happened yesterday, what did I read from the newspapers, what did I plan to do tomorrow. On the other hand, long-term memory can be still quite good. It's easier to remember things that happened 10 years ago or things that happened in the childhood. There may also be difficulties in communication, finding the right words, and to focus and concentrate. Even some mood changes are common. For example, sadness. Many relatives are saying that the first symptoms are actually that the patient is getting more depressed or more isolated. And what is very typical also is that these symptoms develop very slowly. It may take many, many years. My own grandmother got Alzheimer's disease when I was young. And I still remember it was so frustrating for us. We did not really understand what was going on. And the doctors did not know either. And it took at least 5 years before she got the diagnosis of Alzheimer's disease. And this is also partly because of this, I would say, common incorrect belief that is still partly there, that memory loss is a normal part of aging. And I want just to say that now we know that this is not true. Memory loss or dementia is not a normal part of aging. And I would really like to encourage you, if you have a family member who is showing signs of dementia, it's very important to see a doctor and try to find out what's the cause and follow, and if needed, medicate this patient. Now, I would say that dementia has got a much more interest during the last years, and one reason for this is this nice figure showing how population is aging, how expected lifetime has been increasing. You can see this dramatic increase in the expected lifetime. It's really wonderful to see this. And this is partly, or for a large part, because of all these developments in the societies and in the medical care. And this increase just seems to continue. Gulf region, including United Arab Emirates, has also seen increase in the expected lifetime, and now is actually in the top 3 categories in the whole world, with expected lifetime more than 75 years. And it's very interesting that this population aging is just going to continue. At the moment, there is approximately 1% of the population who are older than 65 years. But it has been estimated that in 2030, this number is 6%. And in 2050, it is nearly 30%. So in less than 40 years, there will be 30 times more elderly people in this society. And it's of course very positive, but at the same time it has some consequences for the health. And I would say that now it's very good time to really start working more and more with the aging-related issues. And when I mentioned that this aging of the population has some consequences for the health, I would say that it has especially consequences for the brain health. Brain is often the weakest link when we are getting older, and dementia is getting much more common when we are aging. Here you can see the figures. With increasing age, dementia is getting much more common. So that those who are around 65 to 69, there is something like 2 or 3% who have dementia. But if you are older than 85, then it's already 30% who have dementia. So it's very clear that increasing age is a strong risk factor for dementia and Alzheimer's disease. And as I said, population is aging, and it has been estimated that after 50 years, we will have 4 times more patients with dementia and Alzheimer's disease. 4 times more, it's a huge increase. On the other hand, if we could postpone dementia onset by 5 years, this would decrease these numbers by 50%. From this purple curve to this green one. 50% less patients with dementia, that would have a really huge impact on the patient and families, but also for the whole society. And that's why the question of prevention has got so much attention recently. The question, can we do something to prevent that this beautiful, healthy brain will not develop these Alzheimer changes? Our research has shown that besides age and genes, there are also many environmental factors that affect when we get the disease and if we get the disease. And one important thing is that this process, how Alzheimer's disease develops, is very slow. It can take 20 to 30 years from that time when we get the first changes in the brain until the point when we get the dementia diagnosis. And that means that if we really want to prevent Alzheimer's disease, it's never too early. Risk factors at midlife or earlier in life are very important. And here I will show you a list from our research concerning the most important modifiable risk and protective factors to dementia and Alzheimer's disease. As you can see, there are many vascular risk factors: stroke, high blood pressure, high cholesterol, obesity, diabetes. We know that these are risk factors for heart diseases, so we can maybe summarize it by saying that minding heart health may prevent Alzheimer as well. What I like a lot is that the list of protective factors is getting longer and longer. For me, it feels always more positive to talk about protective factors, not only about risk factors. And here you can see it's quite nice activities: physical activity, active lifestyle, healthy diet, and even medications like medication against high blood pressure and medication against high cholesterol. And what I was thinking to do now is give a few examples about these new research findings so that you get a feeling how this relates to Alzheimer's disease. Here is a first example. Vascular risk factors at midlife. High blood pressure, defined with body mass index over 30. High systolic blood pressure and cholesterol. All these factors at midlife, when the person is approximately 50 years old, approximately doubles the risk of getting dementia and Alzheimer's disease 20 years later. And interestingly, these risk factors increase the risk in an additive manner, so that if a person has all these 3 risk factors at the same time, then the risk is already 6 times higher. And it is quite huge risk increase, larger compared to many genetic factors. And we know that this combination is very common. Persons are not having only one of the risk factors, but often several risk factors at the same time. About diet, we know some factors here. What is the super diet for the brain, we could say? And it's fish oils, vegetables and fruits, and some vitamins, especially vitamin B, C and E, we can call brain vitamins. We can ask if this is then the solution to prevent Alzheimer. What do you think? No. I agree. We have no evidence so far that consuming high amounts of vitamin supplementations would prevent Alzheimer. So always, I would say the first choice is the healthy, balanced diet. Physical activity. Here we have very interesting results from our studies showing that persons who have been physically active at midlife, physical activity at least 2 or 3 times per week, at least 30 minutes per time, so that you get a little bit sweaty, 60 to 70% lower risk for dementia and Alzheimer's disease later in life. And interestingly, what we could also see was that these persons who were physically active at midlife had larger brain volumes 20 years later. And this would mean that physical activity may have many direct effects on the brain. It may increase the blood flow, it may increase different neurotransmitters, it may also decrease the beta amyloid production, what I mentioned when I started my talk. So physical activity seems to have very broad effects on the brain. And it's not only physical activity, also social and mental activities seems to protect. And these activities even later in life, as you can see in this study, persons who were social, physical, mentally active had something like 30 to 40% lower risk for dementia. So it's never too late either. You can always do something to try to prevent or postpone the onset of dementia. And if you ask me what's the best activity, if I should choose one, I would say best one is try to combine these different activities, physical, mental, and social. Maybe play some games with your friends, go out, do something that activates both the body and the mind. One more new finding, and it's more about the psychosocial factors, and I think this is interesting. For me as a medical doctor, it's sometimes so easy to focus only on biological factors. But it seems that behind Alzheimer's disease are also many social and psychological factors. So our studies have shown that people living alone and being widowed and living alone a longer time have an increased risk of dementia. Same thing for people who are feeling loneliness and hopelessness. And especially these combinations, as you can see, people who are living alone and feeling lonely, and people who are widowed and feeling hopelessness, greatly increased risk. And we know that these kind of factors are quite common, especially among elderly people, and it would be great, I think, to try to recognize these risk groups even more and plan supportive interventions. At the end, a few words about the future, what we should do now. I think what is still needed is better clinical trials so that we really understand what's the best way to change lifestyle. We all know that healthy lifestyle is important, but it's not so easy to change lifestyle and maintain healthy lifestyle. And I'm very happy that we have initiated one of the first studies in the whole world aiming to prevent dementia. That study is called Finnish Geriatric Intervention Study to Prevent Cognitive Impairment and Disability, FINGER trial. And in this study, we are trying to do everything what I have been talking today. These persons in this intervention group, they will get dietary guidance, they will get exercise program, they are doing cognitive training, and we are trying to treat all the vascular risk factors. And then we have a control group who get regular health advice. This intervention, it will be 2 years and it will be ready at the beginning of next year. You can see here a picture from the FINGER study. And people are really enjoying when they can participate in this study. They get also some social stimulation at the same time, and they are very motivated. So I'm really looking forward for the results of this study. Second important thing, what I think we need in the future is more international collaboration. And that's why we have started European Dementia Prevention Initiative. And I think and I hope it can be a model that can be used also in other countries and in this part of the world as well. Third important thing for the future is that maybe we should try to use the new technology even better to improve dementia prevention. And here we have a very nice example, an ongoing study from European Union, Healthy Aging Through Internet Counseling, where we have developed a flexible internet-based platform to motivate and support lifestyle changes. And fourth and final thing for the future, what we still need is to find better drugs for Alzheimer's disease. Even though we try to prevent, there will always be patients with Alzheimer's disease, and that's why I hope that we will get better medications in the future. At the moment, we have 4 medications available on the market. They are mainly symptomatic. They don't stop the disease, but they can help for the symptoms. And here you can see all the drugs that we have been trying in different phases. Here are the phases closer to the clinic, and here are the preclinical phases that are still on animal models. And different colors represent different targets. All the red dots are drugs against beta amyloid, the protein I mentioned to you. So far, we don't have yet cure for Alzheimer's disease, but giving all these efforts, I hope in the close future, I don't dare to say any years, but in the close future, we should have better medicines for the disease. So, concluding, finally, is it possible to prevent dementia and Alzheimer's disease? How many of you think it is possible? Quite many, yeah. And I would say also, maybe not totally prevent, because we have age and we have genes. But given how many modifiable factors we have, I hope that we can at least postpone the onset. Instead of getting the disease when we are 65, maybe getting it when we are 75 or 80. And here is my list, the best advice what I can give today. Try to control all vascular risk factors as early as possible. Think the active lifestyle, physical, mental, and social activities. Brain likes new challenges, so try to learn new things. Healthy, balanced diet, but also avoid negative stress. Brain needs also some breaks and some rest. I want to end with this positive picture about our possibilities to affect the brain health. And I'm really happy to see that in Abu Dhabi and in this country, there is an increasing interest for these factors. So I really want to encourage all of us to work for the elderly people and for the healthy brain aging. I want to finish here. Thank you so much.